Let's begin our journey in the distant past, between 3000 and 1000 BCE, when ancient civilizations viewed mental health through a spiritual or supernatural lens. At that time, people believed that mental illness was caused by spiritual imbalance, demonic possession, curses, or the wrath of angry gods. Because of these beliefs, those experiencing mental health issues were often feared or misunderstood. Treatments were quite dramatic and sometimes dangerous, such as trephination, which involved drilling holes in the skull to release evil spirits. Other approaches included prayer, rituals, wearing amulets, and using herbal remedies. These early interpretations set the stage for how societies would continue to grapple with mental health for centuries to come, blending fear, misunderstanding, and attempts at healing. Moving forward to 1000 BCE through 500 CE, we see a significant shift in thinking, especially in Greek, Roman, Chinese, and Indian societies. Influential thinkers like Hippocrates began to argue that mental health issues stem from imbalances in bodily fluids, known as humors, rather than supernatural forces. Galen expanded on these ideas, introducing psychological causes. Meanwhile, Chinese scholars emphasized the importance of balancing qi, and Indian traditions continued to use meditation and early forms of talk therapy. Treatments became more holistic, including diet, exercise, baths, and discussion-based approaches. This period marked a turning point, as natural and medical explanations started to replace older supernatural beliefs, laying the groundwork for more scientific approaches to mental health. As we enter the early Middle Ages, from 500 to 1000 CE, Europe saw a return to religious explanations for mental health. Mental illness was often seen as a sign of sin, demonic possession, or moral weakness, and treatments focused on prayer and exorcism. However, in the Islamic world, there was a different approach. Scholars preserved Greek medical knowledge and advanced psychiatric care. Hospitals in cities like Baghdad, Cairo, and Damascus provided humane treatments, including music therapy, baths, and structured routines. This contrast highlights how different cultures responded to mental health challenges, with some leaning on tradition and others embracing compassion and innovation. The High Middle Ages, from 1000 to 1500 CE, Europe saw the rise of asylums. Unfortunately, these institutions often subjected people with mental health issues to harsh conditions and provided little real treatment. While Europe struggled with custodial care, the Middle Eastern world continued to offer compassionate, medically informed care in dedicated hospitals. Gradually, Europe began to rediscover medical explanations for mental illness, but most treatments remained focused on containment rather than true therapy. This era set the stage for future reforms and the eventual development of more humane and effective approaches to mental health care.